In this module, we will be discussing on gestational diabetes. Gestational diabetes has almost become like a subspecialty of diabetes management. The understanding the criteria, the way we manage, everything is something new from the way we have conventionally looked at diabetes. We should update ourselves in this subspecialty of diabetes, which is gestational diabetes. So in this particular module, we have taken gestational diabetes. We are going to deal in three broad modules. The first module will look into the pathogenesis and the other basic concepts. The second point will look into the controversies about the diagnosis of gestational diabetes. The third part, we will dwell into the management of gestational diabetes. So that is how we are looking at. So in the first part, we will look it into again three broad subdivisions, where like we will first look into the definition. The second part, we will look into the pathophysiology. The third part, we will look into the consequence. So this is three parts of the first part. So the first thing is diabetes in pregnancy, the early days. Pregnancy and untreated diabetes was almost unknown in the early days. True diabetes was inconsistent with conception, a statement probably prompted by short lifespan of women with type 1 diabetes, because that time, like when type 1 diabetes, the patients themselves had a very short lifespan, and thinking of conception in those type 1 diabetic was becoming a big nightmare. So abortion and IUD were quite frequent in those times. Major risk was the death of the mother during or soon after because of the pregnancy due to uncontrolled diabetes. Overall, the maternal mortality was very, very high in that area. From this era, we have evolved. We have now come into a very, very safe phase where we are able to manage the gestational diabetes of the mother as well as the womb, and the other associated thing also we have learnt a lot in these 100 years or so. How do we define a gestational diabetes? Glucose intolerance of any severity. So we need to understand here two things. One is any severity. This is very, very important. With onset or first recognition during pregnancy. So it should be like onset and first recognition. So all these words have a specific implication the way how we have understood gestational diabetes. So which means any severity. It could be a mild severity, it could be a moderate severity, or it could be a very severe form of diabetes also, which might be present. So any severity with the onset or first recognition during pregnancy, very, very important. So the onset or first recognition during pregnancy is gestational diabetes. That is very, very important for us to know. So this definition is applicable irrespective of whether insulin is used or not for treatment. So some of these patients can do well with lifestyle management. Some of them may be doing only with metformin, or in some part of the countries they may be using sulfonylurea also. So they might be with lifestyle management or with oral drugs or with insulin. So it doesn't matter what way you treat. So it doesn't mean that insulin has to be used in this patient to call them as gestational diabetes. So it is irrespective of whether insulin used or not, it is called as gestational diabetes. It is also applicable irrespective of whether the condition resolves after delivery. So there might be few patients where for a particular time, say 6 weeks or so, we check it only after 6 weeks of delivery. So in those cases, it may get resolved or it may not get resolved also. We will deal it in the third part of this, not this module, the overall third part. So it is also applicable whether irrespective of whether the condition resolves after delivery or not. It does not exclude the possibility that diabetes could have antedated the pregnancy. Probably there might be some amount of intolerance or a type 2 diabetes might also be present in the patient. But if it is first diagnosed during the gestational period, then still we continue to call them as gestational diabetes. So women diagnosed with the gestational diabetes may have, these are the 5 possibilities of the presentations. They may have a previously undiagnosed type 2 diabetes. They may have a previously undiagnosed type 1 diabetes, which is extremely rare. There might be a few forms of MODY, which may present only during pregnancy. That is also a possibility. Or there might be a mild glucose intolerance. A pre-diabetic state might be there, which worsens during pregnancy. This is a common phenomenon. But the classical way how patients present is, in a gestational diabetes, the patient will have a normal glucose tolerance prior to pregnancy, which becomes abnormal with pregnancy and returns to normal following delivery. This is the typical. The rest all things also are a possibility, but the typical gestational diabetes, they will have a normal glucose tolerance prior to pregnancy, and that becomes abnormal with the pregnancy, say around the 20th or 24th week, and this returns to normal. The gestational diabetes spontaneously resolves following delivery. So it is all because of the fetus and the other hormones which come into play is the one which is causing the diabetes in these patients. So they will have a normal glucose tolerance prior to pregnancy. It becomes abnormal with pregnancy and that gets resolved with following delivery. This is a typical presentation. The rest all probabilities also might be present in a given patient.